Yes, Cheryl?
Hi, I'm in the hospital today. It's Monday the 13th of December, and I'm in the ward. It's not a ward, it's a room. I'm in a room having chemotherapy.
Which cycle it is?
This is number 2, the start of cycle number 2, and so I have everything's going in my arm here, and I've had first of all they give me some steroids. I've had the steroids, and the steroids is to stop the sickness and to solidify my stomach when I'm having.
And you decided not to run your 100 meters because you will not pass.
I won't pass the drug test at the Olympics this week, so no 100 meters for me. And now I've started the chemo, and I guess they should say the name of the medicine on the bag.
Yeah, this is the first one. You'll have 2 sets of chemos. This is, they call it packs. Oh, 1 second. Yeah, it's like paclitaxel 350 milligrams. This would take about 500 milligrams to take 3 hours, and after this you'll have another chemo which would take
half an hour.
And that's like the strong one. And
oh, is it?
yeah, I mean that one's like, that's what makes it expensive. That's the most expensive one.
What, the other one?
The other one, yeah.
Oh, so this one takes, like you said,
3 hours for 500 ml.
And then the other one's much faster.
30 minutes.
Yeah, it takes half an hour. And I'm just feeling a bit tired really, just sort of like.
Now this is your second one. How you compare it to the first one? Because we all wanted to know the difference between the first and second. Okay, first one was mystery, and
the first one I wasn't excited about, but I just wanted to start because I thought if I started then I'd finish, and so I didn't really think about what was going to happen. I just thought I wanted to start. But this one is a bit more.
You knew exactly what to expect.
This one's a bit more. What are you doing?
Your foot, you see what you're wearing.
I'm wearing socks.
Next time she'll come with a stocking.
I know, this one's a bit. I was much more nervous about this one because I knew how bad it was, and I'm really not looking forward to
day 2, 3, 4.
Yeah, day 2, 3, 4, and but I can survive it.
Not I can survive it. I will survive. You have to say.
Yeah, I can. I will.
Yeah.
But it's just not pleasant, and you can't. And I don't want the hallucinations again, really.
Oh, tell us about the hallucination, about the aliens coming out of the coffee.
From the biscuit barrel and the coffee pot. And
yeah, each grain of a coffee.
no, they're not
pot.
that small. They're bigger. They're big. They're big, nasty things. They come to attack me, and no one told me I'd have hallucinations. And even the doctors were surprised I had hallucinations. But I did have hallucinations.
But we were not surprised because this is Shirley. She's weirdo anyhow.
And I'm not a weirdo.
I'm sorry.
Sensitive.
Oh. What's the sensitivity has to being a weirdo?
Well, I can see things that other people can't see.
Yes.
And so that was the mental game that I talked about earlier. the mental game is being in control of the hallucinations, and you don't realise they were coming, and they're in your head, you're seeing them, and so you have to stop them because they just get bigger. And so I've explained it to Samad this time in the hope that perhaps if I have it this time, he knows that I'm having them. It's not, I think it's just preparation for...
Well, it may not happen this time. My job this time is to stay awake all night and ask Shaylee questions every 20 minutes.
Now, I just want to say something else. I noticed when I look back at the films that we've taken for the video diary that I'm moving a lot, and I'm trying really hard to stay still this time and look at the camera so it's easier for the people watching. But I'm noticing that my feet are moving. It's actually I'm really wriggly. It's quite difficult.
You remember doctor said if you're a hyper.
Oh.
Do you remember? She just mentioned it to you.
Oh.
And he said not really, but you are, but you can't tell.
Oh.
Like you want to leave the house, you want to walk, you want to go. Yeah.
I want to walk. I
Yeah,
want
you
to
are
go
a
out and do
hyper.
things.
Yeah.
And now I'm sitting here trying really hard to be still because I know it's easier for the viewer. Because I've watched the videos we've taken previously, and all I want to do is move. I'm really fidgety.
True.
And that must be what she means
Yeah,
about
yeah,
being
hyper.
Yeah.
Because sometimes when the doctors talk, you just don't know. But once they leave, and you start to talk about it, and you put 1 + 1, and you realize, like everything's from the very beginning. Like even you having.
Is it filming me?
Yeah.
Oh, it looks like it's doing my shoulder.
Oh, Shirley's being a director now. I see she's super hyper, putting her fingers in every single hole available.
I just need to wriggle because I've been still for 5 minutes of the video. It's really bizarre.
Yeah.
It's really, so that would explain it, because the last couple of videos I've tried really hard to stay still, but today it's quite...
Okay, now let's talk about something very important. If somebody else will watch, or you want to help someone in the future, about the jobbies, what you have to do.
Oh, my jobbies.
Because you remember the doctor said you shouldn't be...
when we first came to start this, everything seemed really clear and comprehensive and quite understandable, but she gave me quite a lecture about constipation, and it's almost one of those things that you're embarrassed to talk about because it's... I don't know quite why, but it must just be... Anyway, and last time I suffered, and I used to... Samad's mother used to suffer with constipation, and we used to think it was a bit not really important until you get it, and then you get it, and you're like, you can't believe how unpleasant it is, and so...
And how important not to have it.
Oh yeah,
with
that's
chemo.
where I was going with it. Now, with chemo patients, they treat you with like AIDS patients in one respect, and that's your constipation. You mustn't get constipated, because if you get constipated, you get the bacteria in your body attack your own body, because the poisons are not leaving you.
Not only that, because if you're constipated, you will crack the skin while you're going through the
That's the
jobby,
thing.
and the bacteria will go through the blood inside your system, and your immune system is almost zero.
Ah, yes, it's your immune system. That's why they treat you like an AIDS patient. Your immune system is almost zero, and so And part of that is to get the poisons from the food out of your body as quickly as possible. And so this time I've started taking something called Senecot prior to taking the treatment. Now, the doctor told me that was a good thing to do, and then she said a really long word which I'd forgotten, and that means prior to the treatment. And so
Which means from next time we have to start this before we come to the hospital, even like you did this time. It took one,
last night.
even the last night before, yeah.
And because the anti-emetics, the anti-vomiting tablets, bung you up. So they don't just bung up this end, they bung up the other end as well. And so I'm talking about this a lot because she gave us such a long lecture.
So important.
It's how important it is. You can meet, what she said to us was, you can go and meet people with cold, you can go meet people with flu, you can go meet people with any kind of bacterial.
No, with viruses is fine.
Viruses
is it dangerous
is fine.
with bacteria?
It's difficult with the bacteria from inside you. And that's the key thing of getting sick with this drugs of chemo, is your internal bacteria. And that's why managing that is really important to getting better. Right, I've done the poo talk.
And you did the seeing the little guys in your
Oh, I've done the
coffee
hallucination
pots,
talk.
yeah.
And I think I'd quite like a view from over there, like walking into the room so you can see where I'm having a
This is the room.
hello.
Hi, Shell.
Hi,
How are you?
I'm fine. Today is Monday the 13th of January. No, it's December. I'm
Yeah.
having a real problem with dates.
Well, what do you expect? You're sitting not working. You don't have to do any forms.
Okay, Monday 13th of December, and I'm starting cycle 2 today.
You want to?
And
This is
cycle 2, and I'm just hooked up to the machine with the chemo drugs. You can see the machine. This will take 3 hours to go into me, and so
wow. It shows 1 hour and 53 minutes
we've done all we've got left.
left
We've done
because
an
there's a
hour.
time remaining. They
Alright,
go.
so we've done an hour, and today I'm gonna the key things I think today are about the chemo treatment. So, and what happens to your body when you have chemo. It affects your mind and your stomach, and so that's what I wanted to talk about today. Do you want to see my hair? Actually, you can't ask that question any longer. The question is now, do you want to see my
No hair.
Do you want to see my
No.
skull?
1 second now. Just give me a minute. I'll switch it off and I'll switch
Yeah.
it on in a minute. 1 second.